the whole. Is there any declaration of pecuniary interest? Seeing none, we carry on. Item number 3, business arising from the, well, let's put it, I'm looking for a motion, first of all, put those minutes. My apologies, yes. Councillor McQueen, item number 3, your notice of motion. Moved by Councillor McQueen. Could we have a seconder to get the item on the table? Councillor Mackey. Thank you. Councillor McQueen.
Thank you, Mr. Warden and County Council. I did introduce this notice of motion at the last County Council, just to follow up from the report that was presented to go to the province from the Director of EMS, and basically it indicated that there was an area in Grey Highlands that was an area that response time was lower than the average across the county itself, and I did talk about in that initial notice of motion about having a meeting, and I, with speaking with the clerk, that will be encompassed into this motion, that having that bigger discussion, and then that a report would come back to County Council. So.
That's correct. Any other discussion? Questions? Call the question. All those in favor of the motion? Are there any opposed? That's carried. Thank you very much. Okay, we're on to delegations. All right.
We'll go to,
What do we have here?
I think we'll do consent and then we'll do.
Okay.
Delegations aren't till 10.
Oh, got it. Okay.
Consent, we only have one.
Okay, we only have one item on the consent agenda, dealing with the community drug and alcohol strategy correspondence of February 11th. Perhaps we can get a mover to approve that, at least to put it on the table anyways. It's only one item, so we'll, Councillor Bartnicki, seconded by Councillor Keaveney. Is there any discussion on that item? Well, actually, there's no discussion because no one's really, or you want to discuss it? Why don't I, ordinarily we would put it towards the end, but I think today, because it's the only item, perhaps, is it okay with you, Madam Clerk, that we actually entertain some?
We can, they are part of the delegation that's coming later this morning.
I was going to suggest that if there's an opportunity to ask a quick question of the delegation, we don't need to pull it.
Yes, there will be an opportunity to ask questions of the delegation. Okay, so all those in favor of the motion? Are there any opposed? That is carried, thank you. We'll move on to item 7A, because we have those individuals here. Kevin, I believe that you're going to be dealing with the BDO planning report for the external audit. Can I get a mover, please, to put the item on the table? Councillor Burley, seconded by Councillor Milne. Kevin?
Thank you, Warden. And yes, this is the 2018 external audit of BDO's planning report. So BDO has been appointed our auditor for 2018, and they've provided this planning report of their plan on how to undertake this audit, the timelines, and the items on your list. I have Tracy Smith here, who's the partner from BDO that's our lead on this audit. So I'm going to ask her to come up and speak to their audit plan and allow council to ask any questions.
Good morning.
As well, we have Vicki Watson here as a senior manager with BDO.
Morning, ladies.
Good morning. As Kevin said, I'm Tracy Smith. I'm the engagement partner, and I have Victoria Watson here with me for all the technical questions that you might ask me. So Kevin asked me to highlight the planning report. Generally accepted auditing standards require an auditor to communicate with those charged with governance both at the planning and at the year-end stage of the audit. This report contains all the required communications under those standards, and it's designed to highlight and explain key issues we believe to be relevant to the audit. If you have any questions, please feel free to ask as we go through the report. On page 3, you'll find the executive summary. The items included in the report include your audit team, the timeline, significant audit risks, materiality, engagement objectives, fraud discussion, responsibilities for the audit, and resources. So I'll just go through each of those briefly. On page 4 contains contact information for your BDO team. As the engagement partner, I do have ultimate responsibility for all aspects of the audit. Victoria Watson, as the senior manager, is responsible for supervising the staff and for doing initial detailed reviews. Alicia Mader is the senior and is in charge of the field work and obtaining and documenting the required evidence that we need to give an opinion. Vicki and I have been working with the county for many years, and Alicia was the senior last year. We think it's very important to have continuity staff to make sure that there's an efficient audit and it is unobtrusive as possible to your county staff. We also have specialists available throughout the audit if needed. On page 5 is the anticipated timing. Our audit field work is scheduled to start on April 1st. Meeting with management mid-May and presentation of the final report to the committee on May 23rd. On page 6, we are required to communicate areas where we would focus our audit. These are just some of the areas where we would seek audit evidence to support our opinion. This is an initial plan, and it's not meant to say that we have found problems in these areas. These are just areas where we are focusing our audit. If we do find areas during the audit, we would bring that back to you during our year-end report. Part of our audit, we would look at the control environment, testing journal entries and significant transactions. This is a mandatory procedure for all audits, not specific to the County of Grey. We test controls over purchases and payroll to make sure that they are authorized. We test revenue and grants to ensure that revenue is recorded in the proper period. We look at disclosures for commitments and contingencies. We review actuarial reports to ensure the post-employment liability is accurate and complete. We also test to ensure that holdbacks are recorded and capital assets are accurate and complete. So as your auditor, we provide reasonable but not absolute assurance, so we can't audit 100% of your transactions. So we use the concept of materiality to help us focus our audit. On page 8, we explain materiality. Amounts are material if they would affect the decisions of the users relying on your financial statements. The preliminary overall materiality is $2.5 million based on 2% of average total revenues. So that is standard for public sector organizations. 2.5 million is the overall materiality, but we use what's called performance materiality of 1,875,000. So that's set at 75% of materiality. So we actually use this number in our calculation of sample sizes to determine our sample sizes and to focus on key items that we select for testing. We also then go down to a threshold of 10 to 20% of the performance materiality in our actual testing and analytical procedures.
So Tracy, sorry, I have a question about this whole area of materiality, because it seems like rather big numbers. What am I missing here?
Well, you got to remember that the overall materiality of the county is $128 million. So it's actually it's only 2% of your total revenue. So as we said, we can't audit 100% of the transactions. So the $2.5 million doesn't mean that there's a $2.5 million error in the financial statements. What it means is that we would accumulate any errors that we did find or unadjusted amounts in the financial statements, and we would report them to you at the year end. If the total of all of those amounts was more than $2.5 million, then we would say to you that you needed to adjust the financial statements, or we couldn't issue a clean opinion that your financial statements were not materially misstated. So you are, if we find things, we are reporting that to you at the year end.
Want to add to that,
If I
Kim?
can, I think maybe just to clarify, the materiality threshold doesn't direct the work of the audit, if I will. You're not saying that we only pull the handful of transactions that there might be that would be way up here, right? You pull transactions,
We pull transactions that are in like the 10 to 20% of the
Yes.
performance materiality, so we're down to like 187,000. Would be kind of where we're looking at transactions.
Thank you. Sorry, I threw you off, did I? You're on page 8.
I was just making sure I had everything on that materiality. The last part was that we do communicate any differences on adjusted amounts that we find during our year-end planning, so. Then we get into the appendix, page 10. It's just an overall overview of our BDO audit strategy. This is consistent with generally accepted auditing standards as prescribed by the Canadian Professional Accountants Association. It's a multi-step process where Vicki and we do have extensive involvement throughout the audit in both the planning and the execution and review of the audit. On the next page, on Appendix B, we confirm that we are independent, so we confirm we are independent both at the planning stage and at the year-end stage. Appendix C sets out the responsibilities of the auditor, management, and council. So as your auditor, we have a responsibility to provide an opinion on the financial statements that are prepared by management, to make sure that those financial statements present fairly in all material respects in accordance with accounting standards for public sector organizations. We work with management to issue these financial statements to you in a timely manner, and we present any findings that we find during the audit that we think are relevant to the council at the year-end presentation. The auditor does have a responsibility for looking at responsibility for planning and performing the audit to provide reasonable assurance that the financial statements are not materially misstated both from error or by fraud. So we use professional skepticism throughout the audit to make sure that there is nothing amiss. Council's responsibility is to appoint an auditor for the county and also to approve the financial statements. Management's responsibility is to maintain adequate accounting records and to provide annual financial statements to the county to safeguard the county's, and internal controls to safeguard the county's assets. Appendix B is just a look at any new accounting standards. So there are a couple of new accounting standards. There are 4 new accounting standards. They are a disclosure requirement only, so they don't affect the numbers of the financial statements. They relate to inter-entity and related party transactions, and also to contingent assets and contingent revenue. At this time, we're not anticipating any new disclosure is going to be required for the county, but if we do find throughout our audit that there is, we would disclose that to you again at the end of the audit. One new standard that will affect the county, and this also affects any audit engagement, so whether that be a public sector engagement or a not-for-profit engagement or even a private enterprise, the audit report is that we issue as a professional accountant is prescribed by the accounting standards. That format has changed, so the audit report will be much larger, much lengthier. The audit opinion will be at the beginning of the audit report, that's basically the difference. Is there may be some other issues other matters that need to be disclosed, but again, at this time, we don't feel that that's going to impact the county, so it will basically be longer, and the opinion will be at the front. So, Appendix E is the engagement letter, so as required by auditing standards, BDO is required to have an engagement letter between us and the county, and it's BDO's policy that engagement letter is updated every 3 years. And I think that it was a very high overview, a very fast overview of the planning report. Again, I will be back in a few months to to highlight some actual exciting numbers.
Counselor, any questions? Counselor Soever?
Oh, one thing that's not in here is, what is the cost of anticipated cost of all this gonna be?
So we are under an RFP with the county, so this is the 5th year.
One-year extension we did.
Okay, so there was a one-year extension of that RFP, and that's, those fees are set in that RFP. $63,500.
Well, thank you.
Any other questions? Vicky, anything to add? Well done.
Myself by calling her Vanna.
Okay, then seeing no further questions, I'll call the question. All those in favor of receiving the report? Any opposed? That is carried. Thank you very much.
Thank you.
We'll move to 7B. Are we going to go back to, oh, they're here now, okay. Sorry, we were just, council, so you know, we were waiting for the delegates were to arrive at 10, and so that's why we jumped ahead in the agenda. So we'll go back to the delegations. Mary Ip and I understand David Morris are here from Making Grey Bruce Home. Good morning.
Warden Hicks, councilors, and senior staff of the Grey County. My name is May Ip. I'm the project coordinator of Making Grey Bruce Home, and today I have with me David Morris, who is on the advisory committee of the Making Grey Bruce Home, so he is one of my bosses. And he's also a member of the board member of the Welcoming Community Grey Bruce, who is instrumental in initiating this project. It is an honor to be here again to talk about Making Grey Bruce Home. I was here in June when we were only a few months into our projects to kind of give the council an introduction of what we intended to do. And so today, as our project is wrapping up, it finishes in a couple of weeks. We would like to give a report on what we have done so far and what we're hoping to do moving forward. So Making Grey Bruce Home is a 14-month project which is funded by the Ontario government, and it is a partnership between the United Way and Welcoming Communities Grey Bruce, both of which have had a history of working with the community in the grassroots level, helping people who are new to town and helping vulnerable people living in the community. So in addition to the Ontario government fund, we also have received some grants from Community Foundation and the Power Workers Union to support our programs. And we are also, we work with the vulnerable newcomers, but we also work together with New to Grays, a project you're probably familiar with, which is a Grey County project. We have delivered many workshops in different communities about diversity, cultural diversity, to community, to municipal staff and service providers and employers. So Making Grey Bruce Home is the first ever settlement project in Grey Bruce. In the past, newcomers came and went because there's not really some support to help them stay in the community. However, about 3 years ago, we see a significant group of Syrian family, sponsored by different private sponsorship, coming to the area. So that makes the needs of helping newcomers to integrate becoming very visible. Unlike urban centers, the population in Grey Bruce is spread out, and we lack of convenient public transportation. So the conventional settlement service delivery model doesn't work with our rural communities. So Making Grey Bruce Home is a project to find out how we can mobilize the existing resources in different communities to help support the newcomers in places where they live, so that they will settle down and eventually stay in the community. To conduct the community mapping and identify service gaps, we have consulted over 40 service providers and community groups, and we also work with over 40 newcomers' family to help connect them with resources and identify along the way what is needed, how we can help them, and what needed to be added in the support network. So we're talking about 160 individuals, and that is quite a change from when we first started the project. So when we first started the project, the newcomers that we're connected with are mostly refugees families who are sponsored to come, and there are about 13 families. And as the project evolved, and one of the things is because we have a storefront in the downtown area, so we become very visible, and thanks to the media, they mention us, and service providers were connected us with the newcomers too. So we throughout the 14 months, we are seeing increasing number of newcomers connecting with us and asking for our support, and also the diversity of the cultural backgrounds of people. So to give you an example, a couple of weeks ago, we had a dinner and social at our welcome center, and we had 84 people attended. 2/3 of them are from newcomer families, and they are from 11 different cultural backgrounds. So I think it is an indication that there is a need for the service, because people, not only that people are starting to come to our community, but also in the past, because there is not a settlement support in the area, so the people who are here, they didn't know who to turn to. So with our existence, we are drawing out these people who actually need some help to integrate in the community. So we have also, in addition to talking to the local service providers, by local I mean all over Grey Bruce, we have also visited different settlement services in the surrounding area, like the immigrant services, Guelph, Wellington. We went to visit the Newmarket Welcome Center, and discovered that they actually have a mobile service going to Collingwood every two Tuesday every month, and we have also talked to the Huron local immigration partnership to learn how they work in helping newcomers to settle, and of course our model is very different, but it's always nice to talk to people who are already have established and working with more experience working with newcomers. We have, so along the line, we collect all the information, and from the information we discover the needs of the service providers, what they're eager to help, and they're a little uncertain. The frontline worker is a little uncertain how to work with people who are from different culture. What kind of barrier there are? So we deliver altogether 7 service provider training workshops in different locations. So in Owen Sound, in Port Elgin, Walkerton, and Dundalk. And we have altogether 183 frontline staff from 40 different service providers attended the training, and out of that, some of them were a few trainings were in-house. After the frontline staff attended the workshop that we offered, they thought it would be a good idea to bring us into their agencies and train more of their staff. So I think it is really nice for us to see that the service providers are ready, and they wanted to do the best to help the newcomers. We have also provided training for volunteer mentors, because I think in our model, the volunteer mentors play a very important role, because as these communities are so spread out, it's not easy to get to them. So in order to build a supportive network, it's nice to have people who are around them, like their neighbors or people from the churches and things like that. So we have also delivered the training for the people who are interested in helping their people in their community. So now we are into the final stage of our project, and we have. I think we have achieved what we have set out to do, and that included developing an online resource platform where the newcomers, service providers, community people, and volunteers can go to and access. So it is if you're interested, the URL is newcomersbrucegray.ca. So it is a website called Newcomer Information Bruce Gray. And basically what it is a portal on the 211 website. So we come up with an idea that we want to have a website which is accessible to especially newcomers, and they build it for us, and it tap into their database. So the even after the project, the database of all the community support and organizations get updated by the 211. So it is always up to date. And the one thing unique about our website is that it can be searched in 24 different languages. So we in our research period, I looked up the Statistics Canada's database, and also consulted my colleague at the school board, and we discovered the diversity. Again, it is pretty surprising to discover that we have quite a diversity of languages that are considered to be mother tongues in the Grey Bruce community. So based on that, we picked these 24 languages, and to make sure that people who even without without English, they will be able to find the services that they needed in the area. So and then the other thing that we are in the middle of finishing is a toolkit for rural communities. So our project is an experiment. We hope that with the success that we have, we would like to share with other rural communities who, like us, doesn't have an established settlement service, so that they can find their own way to help people settle. It is a fact that newcomers are wanting to move out of the urban area because of the cost of living, and it's also a fact that rural areas are in shortage of people to fill jobs. So in order to ensure that when people come up here, their families get the wraparound support, I think it's important for rural community to learn how to be ready and have things have services in hand when that's needed. So looking forward now, we are hoping that we can, of course, continue our work, but the funding is finished. So I think we have a couple of things going on right now, and I'm going to pass the mic to David Morris, my boss, to talk about what we have in the near future.
David, you're described as a boss, but you don't look very bossy.
I try not to be. That's not a word that I would use myself. Thank you, Mr. Warden, also for having us here. I would describe myself as a colleague in this project. I'm part of, as May mentioned, I'm part of a group that's now calling itself Welcoming Communities Grey Bruce, and we were the volunteer group that basically wrote the application for this project. And we've been a partner with United Way all the way along. They've kind of looked after the money side of it, and the people from our group and some others have served an advisory role as to what, you know, how the project should be delivered. And as May pointed out, because it was a short-term project, we were careful not to try to do too much direct service ourselves. We were wanting to enable the groups and organizations that are already in the business of providing service to the public, be better able to provide those services to newcomers as well as those of us that were born. So moving on, as May mentioned, this project comes to an end. We had a consultation on Friday, which we had over 60 people come to from various groups within the, across Grey and Bruce, and they said, we need to keep doing this kind of stuff. So we're in the process right now of, we just completed a process of submitting an application to the federal government for funding for a one-year, basically a one-year project to help visible minority newcomer women enter the workforce here. We're now just starting the process to apply for a substantial grant from, again, from the federal government for the whole package of settlement services, which covers just about everything. It's a 5-year, up to a 5-year project with basically all the money that we would need to do to set up a settlement service, however that would be delivered in this region. And we certainly realize that we do not want a centralized model where everybody has to come to Owen Sound or wherever to get services. We may mention the idea of a mobile service, and that's certainly something that we're kicking around so that regardless of where a newcomer comes, they can get help they need. And further down the road, there's another grant program coming open that allows for funding of something called a local immigration partnership, which is basically an umbrella organization that formalizes bringing groups that have an interest in this aspect of how do we integrate newcomers into the community to provide guidance as to what needs to be done. So we're going to be looking for partners on both of those projects as we go along. And the other piece is that we've also just submitted an application to become a nonprofit corporation. So I think I've used up my time. Thank you very much.
Thank you very much, David, and thank you, Mayor. Council, are there any questions or comments? Kim?
Can I just ask, Mr. Morris, are you in need, would it be beneficial to have a letter of support?
We have had, we did get a letter of support from Grey County for the project that's just finishing up. And we did get a letter of support for the application that we just submitted for the visible minority women. And we will certainly be asking for letters of support for whatever goes ahead. And we're actually having a meeting this afternoon to start to think about what is it we're going to do with this project, or what would we like to do, and who are we going to involve in partners, and how they're going to be involved. So you will be hearing from us.
Sure we will. Well, thank you very much.
The other thing I haven't talked with May about this, but we're in the process of submitting a report which goes to, I can't keep track of the names of the government ministries now. It used to be the Ministry of Citizenship and Immigration, but that's got merged into something else. So we will be submitting a report to that. It would be my hope that we can modify that into a report that we can share with the general public as to what we've done and what we see need to continue to be done.
It's excellent, thank you. And now you're showing the bossy side, telling us that May didn't know.
As of the end of March, May's no longer our employee. So
Because the project is done. But we have hopes of being able to restore her tonight.
Good luck with that. Thank you very much for the presentation. This is really important work. Thank you. Do we have, is Allison here as yet, or do we move on? She is? Oh, there she is. A familiar and friendly face. Allison's with the Community Drug and Alcohol Strategy. Who are the current councillors on that body? Councillor Mackey and, is it? Just you, and Desai, okay, right. Good morning.
Fellow councilors, it's an honor and a privilege to be here today to speak on behalf of the Community Drug and Alcohol Strategy. In Grey and Bruce counties, rates of emergency room visits have tripled since 2002. Those rates are related to substance use. Half of them involved alcohol. We see the same rate of increase for opioid use. I'm just going to pass around some of these stats in visual form, just because sometimes it's easier to sort of let things sink in when you can see them. So 31% of men in Grey and Bruce County report regular heavy drinking, and this is double the rate for women, and it's significantly higher than the provincial average. Overdoses are on the rise because of dangerous, toxic drugs in the illicit market. 11% of our student population has tried opioids in the last year. This is a 2% increase from the year before. And most of these opioids are coming from parents' medicine cabinets. So when I read stats like this, it's easy to distance ourselves and to think instead about faceless people who get caught up in, a certain lifestyle. But the reality is that at least half of us will experience mental illness or addiction by age 40. Mental illness and addiction doesn't discriminate by gender, race, creed, or age. At this very moment, you might be thinking of someone, a loved one, a spouse, a daughter, a neighbor, a friend who is struggling. For many people who struggle with mental health and addiction, it's hard to reach out for help. We're more likely to talk about our physical illnesses, like a heart condition or cancer, and to hide our struggle with depression or substance use. It can be a lonely place to live, and it can exacerbate our symptoms. So, what if we cease to think about addiction as a moral failure, but instead as a health issue, like a heart condition or cancer? We believe, as members of the Community Drug and Alcohol Strategy, that through connection, advocacy, education, and policy change, the stigma associated with mental health and addiction will stop. Addressing substance use through a public health lens helps us look at the whole person. It helps us see those who use substances not as addicts or users, but individuals who are our sons, daughters, mothers, fathers, brothers, sisters, neighbors, and friends. So this work of fighting stigma and looking at substance use through a health lens is already well underway in Grey County. This week, over 2,000 people came out to the Leafs alumni game at the Bayshore to support mental health awareness and wellness programs at the Canadian Mental Health Association. Our paramedic services here in Grey County, under the direction of Kevin McNabb, are pioneering an overdose response system that is the first of its kind in the province. In Owen Sound, Grey Bruce Health Services was one of 7 pilots across Ontario to set up a rapid access addiction medicine clinic. This allows people who are struggling with addiction to access a family physician with a specialty in addictions to access essential medication and counseling. Grey Bruce was one of the first rural communities to set up a multidisciplinary opioid working group, and we were consulted by the ministry in 2016 on the provincial opioid strategy. And finally, in 2014, we created an addiction court support program, recognized now by the LHIN, who offered funding to the program. We didn't have to ask for it. They found it, and now they are offering ongoing funding. So integrating new and innovative initiatives that are based on best and promising practices is not something that we shy away from here in Grey County. So each organization is doing really important work, but this issue is bigger than any single organization. And that's why the Community Drug and Alcohol Strategy brings together service providers in health and beyond, businesses and community members, and we all work together to reduce the health and social harms associated with substance use. So some of the examples of our work. Our opioid working group, which I mentioned earlier, which came together in 2016. The first thing we started to do was look at local trends. A question that we were asked fairly often was, is the opioid crisis happening here in Grey County? And the answer is yes. Opioid overdose is on the rise. Emergency room visits are on the rise. This is data from Ontario Public Health. This is an interactive portal that's available online where you can get up-to-date medical and healthcare information on the opioid crisis. So our opioid working group has been working with paramedic services to develop an opioid response plan. Paramedic services can send real-time alerts to our public health unit, alerting public health of overdoses as they're happening. So 2 weeks ago, for example, there were 3 overdoses that happened in a span of 12 hours, 2 of them in Owen Sound and 1 in Hanover. We were able to get that information in real time and send it out to all of our community partners who are part of the opioid working group and beyond. We were also able to connect with anecdotal information from paramedic services and police to identify the substance that was believed to be used for these overdoses, and in that case it was purple fentanyl. So this is an example of the work of how important it is for us to all come together in order to get vital information, not only to service providers, but to those who are using substances who may be at risk of ingesting a toxic substance that is in the illicit market. Another example of our work is the Cannabis Legalization Working Group. This is a collaborative of school boards, paramedics, police, specifically community police officers, addiction counselors, and public health. Over the fall, we put together a series of 10 community-based workshops for parents. These workshops were to help dispel some of the myths around cannabis in wake of cannabis legalization. So we know that about 23% of our young people are using cannabis, and that rate increases with age, from grade 7 to grade 12. We also know that young people believe that cannabis does not impair their driving, and that it's actually safer to use cannabis than to use alcohol before driving. So we held these community sessions for parents to help arm them with accurate information about cannabis so that they can have open and non-judgmental conversations with their youth. We're also sponsoring the Weed Out the Risk program in the schools, which is a partnership with public health and two of our school boards. And this is based on best practice techniques in order to have conversations with youth in their classrooms about cannabis. specifically around impaired driving and cannabis. And so we're actually doing a train the trainer type of model where phys ed teachers, guidance counselors, youth addiction counselors, driver's ed teachers will come together to learn the content and be able to integrate that into their work with young people. So another big part of what we do is strategy and coordination. So I think some of you have in front of you the data report exploring trends in substance use and related harms in Bruce and Grey County. So that was a report that we developed with Alana Leffley, the senior epidemiologist at Public Health. It's the first of its kind report in Grey and Bruce, and it can be used as a baseline to understand how trends are changing over time. We also make sure that we're integrating the voice of people who are using mental health and addiction services in our work. And so we have conducted learning exchanges with folks who are accessing group services at what was Hope Grey Bruce Mental Health and Addiction Services. And actually what we did was we took the data that's in front of you right now and we put it in front of them. And we said, tell us about your impressions of this data. How does this relate to your experience? And what we find out is so rich and it's so important. And so what we're gonna do moving forward is bringing these folks who are using services into the fold to make sure that their voice is equitably represented around our table. We went through a strategic refresh this year, which involved 23 different community partners across sectors. And our next order of business will be to develop an evaluation framework. And so we've been working with the University of Toronto and the Ontario network of drug strategies to develop an evaluation framework that we can apply locally. So I just want to mention some of the factors that allow us to do this important work. One is dedicated staff time. So the investment that is made by the counties, both Grey County and Bruce County, currently covers my salary. At this point, there is more money going out than coming in. And so we understand that in about 3 years, that we will need to be looking at additional funding sources. I already talked about, involving the voice of those who identify with having mental health and addiction problems. We also have very strong commitment from municipalities, from council, county council, and from influential champions across both communities. We've been working closely with pharmacists in the last couple years, recognizing that pharmacists are really, integrated in their communities, and they have this wealth of knowledge, and they're very keen to participate. So those are the main ideas I wanted to convey today, but I'm happy to answer any questions about what we do and what we're doing moving forward.
Thank you, Allison. Maybe I can start. I know Councillor Bartnicki has a question, and you talked about funds going in versus coming out, and I'm looking at the summary of your revenue and expenses. So it looks like 40,000 going in each year, and in the next year, 91,000 will be going out. So is that what you mean? I see these, 137 carried forward. Carried forward from what?
So I'll give everyone a bit of the history on the drug strategy. For those of you who have been around the table for a while, you might remember the Grey Bruce Task Force on Crystal Meth. It was established in response to a very serious and dire situation in the Hanover-Chesley area where parents and and student success teachers and municipal leaders came together, and school boards, to address collectively the issue of crystal meth that was affecting so many young people. And at that time, the counties dedicated, I think it was $40,000 each, to the task force on crystal meth. Now, at that time, all of the work was being done off the side of the desk of each of the members. And as the group grew and evolved and the mandates started to shift, it was clear that a coordination position was required in order to move the group forward. So for a time, there wasn't a lot of money going out. And part of that is actually a good thing, because that's when the LHIN picked up the court support programs. So the task force on crystal meth, they were using the funds to support the new position that was created in Walkerton and Owen Sound. And then when the LHIN picked it up, all of a sudden, that money wasn't going out to that program anymore. And then so shortly after that is when they created the coordinator position. And so I've been in that role for 2.5 years. And so the expenses, the expenditures are looking a lot different now than they would have 5 or 6 years ago.
Okay, Councillor Bartnicki?
Thank you, Warden Hicks. Just a couple of thoughts on this. October 11th, I know, Allison, you and a great panel were in the Town of Blue Mountains Hall, and it was packed to the rafters. In fact, the whole atrium was standing room only. After that, the Town of Blue Mountains, like many municipalities, were in the position to approve retail sales. Some did, a few did not. I think at that time, for us at least, again, we were packed. So those were the two biggest events since September in the Town of Blue Mountains in the hall. It drew more people than anything else. I was there when you presented. There are still lots of questions from those parents and from community members who are not parents about this. This report is fantastic, by the way. I really commend you. But do you and your organization have plans to do another round of educational visits?
That's something that's come up at our steering committee a number of times, where, and you see this happening throughout communities, that there's an education event and it's well attended, and it sort of plants a seed for folks. And then perhaps there's no follow-up, so having consistent messaging and consistent programming and opportunities for people to connect with the information is so important. Now, I have to say that we're restricted by how much time I have to contribute to a lot of this work. So putting together those 10 sessions across both the counties was basically my job for 2 months. And so to do another round of that is absolutely possible. It's a matter of balancing the time and resources of the drug strategy with the priorities of the community at the time. And so to address that, we made a toolkit. So it's a toolkit, and the audience is parent councils. And so I can share that with this group as well, but basically it is meant for parent councils to have a step-by-step guide on how to put these type of events together and who to reach out to, and then the drug strategy would become a liaison. Now, we haven't had much uptake on the toolkit, so that might be another area of promotion, but I hear what you're saying.
As a follow-up, people are aware that the provincial curriculum in health and phys ed has been suspended. In that, there was quite a bit of education, but it's reverted now to the previous document that does not have any of that, does not have a a lot of other things too. So I'm really concerned that there's a gap in here. While we were on the verge, I don't believe any of us will have retail in the next 6 months at least. But as we do have that in our communities, I think there's a really growing need for that type of education, not just for school councils. School councils account for about 3% of parents. So we're not reaching maybe the people that we need to reach. We're preaching to the converted, but I think we have a real gap in that need, and you know, I'm happy to do what we can to bring it to our municipality, but I think it's preventative for our whole county to engage in these things so that 10 years from now, we're not seeing other issues that are on our plates. Thank you.
Councillor Bartnicki?
And can I just follow
Yeah.
up very quickly? A couple other programs that I should mention that are happening in the schools is the Mental Health and Addiction Champion Program. So that's a youth-led program. So the older youth get training, a full-day training on how to talk to their peers about mental health and addictions, and then they start up projects within their schools with the younger staff or the younger students. And then one of our Catholic schools is piloting a brand new or a new program called Challenges, Beliefs, and Attitudes. And that is a preventative measure to help youth reflect on their own coping mechanisms and also their own like styles of you know, being well, and then doing a peer-to-peer program around that. So there is a lot going on, but I recognize that it's not well communicated. Like, not all of us know about all these things going forward. So, but we are working with the school boards, and absolutely more work needs to be done.
Councillor Keaveney?
Thank you very much, Mr. Warden, and Allison, really appreciate your presentation today. A question, if I may. You mentioned the availability of supports and counseling and so on, and recognizing the magnitude of the numbers of people who are suffering with mental health and addiction issues. I wondered if you could speak to the wait times for counseling. Are we reaching people in time? And thinking as well of the facilities that are available for people, are those wait times improving, or is that just a growing problem?
I'll speak to that as much as I can. Normally I would have Dave Roy here with me, who is the Director of Addiction Services at CMHA, and he could speak more about wait times. But yes, wait times are a big concern in this area. The mental health and addiction sector is sorely underfunded. It's a fragmented sector, so funding is coming from multiple ministries, and we're living in a rural area, which makes it very difficult, especially to reach folks who are you know, living in the smaller hamlets. I believe, actually, I don't want to give numbers for Hope at paramedic service, or sorry, addiction services, but I do want to say that there is some shifting in the model of how people can access addiction services. So, for example, there is an amalgamation underway right now of mental health and addiction services across Grey and Bruce. So what was Hope Grey Bruce, CMHA, and G&B House is now all under the umbrella of a new chapter of CMHA. And so they're looking at getting a single phone number to call, rather than trying to figure out you know, what number to call for what service. And in that restructuring, they will also be looking at the flow of service and how to get people in faster to the services that they need, whether it be long-term counseling or brief counseling, you know, just to get connected with a doctor, or, you know, whatever that client needs. But yes, I would agree. When we talk to clients at Hope Grey Bruce, you know, what I heard was, you know, I'm glad that I found this program. I'm really happy to be, you know, in this group program, but it took me far too long to find the front door. around the door.
Councillor Keaveney?
Thank you, Mr. Warden. And a second question, if I may, Allison. Is there a strategy afoot to reach, I appreciate all you're doing in the schools and with the youth to reach them and to educate them. Is there a strategy discussed at all about how to reach those adults in our population who just don't want help, who just can't or won't acknowledge that they have a problem and that they just refuse help, that an ambulance can come to the door and they will say, I'm not going, and you can't make them go? Is there any strategy to reach those people?
That might be the most difficult question to answer, and it's a good question. At our last meeting, we had someone come talk to the group about mental health among rural farmers. There's a study done in Grey County, some of you might be aware of this. The University of Toronto's Department of Public Health conducted a study, and what he shared with us was that farmers who are struggling with mental health and addiction issues are not likely to reach out for help. They take care of everything on the farm. So they feel that they can take care of themselves as well. And it's not something that's talked about. So he did like a qualitative study where he had conversations with about 25 different farmers. And we talked about, how can we reach those farmers who are under so much stress, often in their business. And meeting people where they're at was something that came up a lot. Being in community was something that came up a lot, and it's a challenge, right? It's a challenge because we only have so many resources, so we can't be everywhere at one time. I don't think I've answered your question, but I think it's a really good question. Another strategy is to make sure that we have people on board who have been through mental health and addiction struggles and who can speak to, when I was at that stage where I didn't want anyone's help, this is what it felt like and this is what would have made the difference for me. So it's just important to have that voice around the table, and that's what we're working to do a better job of.
So before I go to you folks, I see your hands. Dr. Era is still here, and Kevin, I just wonder, is there anything that you want to add to this?
For the interesting talk. I just want to add that the coroner's data for 2018, right, last year, death in Grey Bruce from overdose was reassuring in some ways and opens the door for new challenges in another way. There were only 12 deaths, and none of them were homeless, none of them were from what we all perceive as the people who are typical overdose. All overdoses, the 12 of them, were people who lived in their own residence, were employed, were around between 40 and 52 years old, around 52. That's any one of us. And that's really the good news here, that our effort to target the people who use on the street has been, seems to be, has been successful. We eliminated these types of overdose in the street. The theory that we're going to be working with, and if we can prove it, that's great. If not, we can actually tackle theoretically and see if there is result, that these victims were probably people who used prescription opiates based on a prescription from physician for pain or whatever it is. And at some point when the Royal College advised physicians to cut down on use, these people had to go to the street. And, we have messages targeted to the whole population, but not targeted specifically for them. So this is our plan for 2019 and 20 to see if we can tailor our messages to this group. Thank you.
Thank you, Doctor. Kevin, anything to add?
The notification system that we have in place is something new for Ontario. We send all our ambulance call report information to the LHIN, so they have transported, not transported, deceased, and then we've been able to add the opiate code as far as the overdose. So the way that works is that when a call is uploaded by the paramedics, when they complete a call, we can get it as near real time as possible. So it's based upon the presenting symptoms. It gets it off the primary code, and also it's a secondary code if it was a cardiac arrest. And that also measures if we give naloxone or not. So there's about 3 ways of picking it up. The idea of that is that it sends it to the LHIN. So from there, we can send it to pretty much any health partner in the province, but we do send it to public health. And so they have somebody monitoring that as well as our supervisors and myself. We get it on our phone. It sends us an email alert every time there's an opiate overdose. So generally it's conversations that start. And then we look at the calls, and we can extract information that we keep amongst our group, but we talk about, that could, help identify something in the municipality, or something to get information out to the people working in the street, that they can get out to people that are using and what not to use or what to look for, or that something's changed. And as far as just reaching out to help people, as far as addictions go, we don't have a referral process yet, but it's something that could happen in the future. But we do respond, the mental health urgent response team. It's something that we do here as well. I don't think it's really done anywhere else. Is if there is a mental health behavior, the code is behavioral disorder in our CAD system. They send out the mental health urgent response team with those calls. So the whole idea is, because there is quite often these people don't want to go to the hospital, and it helps them connect to resources for up to 30 days. So that's something that we do in the background as well.
Thank you, Kevin. Sorry to hijack your delegation, Allison, a bit, but this is a very good conversation. Now, Brian?
Thank you, Mr. Warden, and thank you for your presentation, Allison. It's very good. In regards to mental health in the ag industry, it's in my mind at least, it's not so much we need to get to the people directly that need help, because they're not going to ask. There's a whole culture around agriculture, because it has primarily been a male-oriented industry, although that is changing. But the culture around, I'm fine, I can deal with it. But I think the important part is that we're having the conversation, and people that don't necessarily need help understand that there will be, and are people in our community that need help, and there's telltale signs to look for. So if your neighbor starts doing or not doing something that normally is done, there's signs around. Maybe go over and just sit down and have a chat with them, and pick their brain and talk to them and reassure them that the community's available, help is available. Just have that conversation. We can't, I'm not telling anybody here anything they don't know, or shouldn't know, but I think the important part is we're having the conversation in our communities now, and that people don't feel stigmatized or isolated, that help is available. So thank you very much.
It's an important message, Councillor Milne. Thank you. Councillor Mackey.
Thanks, Warden, and just wanted to pass on a sincere thanks, Allison, to you over the last two and a half years. Warden Hicks and I sat on the committee right from the last 4 years, and certainly there's been a positive evolution in the amount of work that's being done. Certainly a thanks to Barb and to Dave Roy, who are the co-chairs. A lot of work was done on their backs prior to you coming, and they're still, very much involved. But, there's been a tremendous amount of work done that I've seen in the last 2.5 years since you became involved. One of the big things that, sitting at the leadership group is having all the other agencies from Grey and Bruce counties there. It's really good dialogue to hear where the issues are, where the problem areas are. You have school board, you have children's aid societies, you have probation services, youth mental health, adult mental health. You've just got, all the cross-section of services that are in Grey and Bruce, so it's just a great leadership table, and I think there's been very positive work done, and we're getting really good bang for our buck here. So thanks very much.
I agree. Thank you. Are there any other questions? Councillor Mackey?
So one question is probably to Dr. Era, just in regards to what the medical community is doing in regards to the amount of opioid prescriptions being given out. As you had mentioned earlier, Dr. Era, a lot of the addiction problems stem from pain relief at some point in a person's life, and then they become addicted and hooked. And, you know, in years gone past, doctors were giving out, you know, pretty big bottles of prescription medication, and there was problems that occurred after that. So is there any work being done with the doctors and the pharmacists to curb some of that use?
Certainly, I can give the update. I just want to emphasize what you said, that the issue really started 20 years ago with prescription medication. Physicians bought into what pharmaceutical company described as safe drugs, not addictive. They used, when you look at the research, it's, the data could be presented in different ways, but when you see a rep coming to the doctor and using all the marketing techniques, the data really doesn't stand much. So over the past 20 years, people used opiate as, like to meet, comparing to opiate in Europe. Here, you can get it as easy as candy. In Europe, there's only a specialist that would prescribe it. The resident wouldn't, family physician wouldn't. It has to go to a specialist, while here, everybody did. Anyways, in the past 2-3 years, there has been awareness from the colleges to educate physicians, don't give it lightly. There was the mistake of people withholding suddenly, and that's what led people to go to the black market. Recently, just in the last few weeks, there has been announcement from the colleges at the Family Physician College and the Royal College that any prescription opiate will come out with a pamphlet with a set of information. This is dangerous. Like I've seen many people, one of them is my mom. Luckily, she didn't use it. My mom is a retired nurse. She would know about opiates. But an old person who cannot really see much, she got a prescription for strong opiate. And she thought it's just Tylenol, regular Tylenol, and she had it in her drawer. Luckily, she did not get sick or any type of pain that she would have used it. Otherwise, like a week of this, she would be just an addict completely. Like the word addict is probably not the best word to use. Her body will be hooked. So that's the last update in the past 2 weeks. I don't know when it's going to come in effect, where every prescription would carry that warning with it.
Thank you, Doctor.
Sorry, if I may add, it's worth adding that everything we see right now about marijuana being safe, being a natural way to deal with pain, these same words or similar words were used 20 years ago for opiate. And here, fast forward 20 years, we have a crisis on our hand. And that keeps me up at night, that marijuana for our kids, for the new generation, is being perceived as this is natural. And really, there is nothing natural about it. Smoking it.
Thank you, Doctor. And thank you, Allison. Sorry, did I miss someone? Oh. Barb, Feedy?
Thank you, Mr. Warden. I just really wanted to thank Allison for today's presentation. She's been here before, and I haven't been able to thank her quite well enough over the years to say that this has taken a huge load off of my plate and my colleague, Dave Roy's. We are the co-chairs at that committee, and we've been with it since the early days, probably 8 or 9 years ago now, when it was really focused on a galvanizing issue of crystal meth, and we've since opened it up and included alcohol and opioids and now the marijuana cannabis piece. So it's a collaborative effort, and having a dedicated resource has really allowed for us to move forward. Allison presented at Bruce County Council as well recently, so your colleagues will have had this same information, and it's really important to acknowledge the multiple sectors that are coming together, because we can't do it by ourselves, and it crosses so many, and we mentioned a few earlier, but there's probably 30 of us that are really coordinated through this initiative. So a small contribution in our budget, which was $20,000, and I appreciate that you've approved that. That's in our social initiatives budget, and you can see what kind of work we're doing with that, calling together our resources. Thank you, Allison.
Awesome. Thank you, Allison.
Thank you for your time.
Okay, Council, I think it's time for us to take a short recess, perhaps. I don't think anyone will object, and we'll come back and finish up. Councillor Woodbury, seconded by Councillor Robinson and Amanda Brooks. Mary Lou.
First, Mary Lou. So I'm just here to do the intro. So Amanda started with us last August. So this is her first report to committee. So please go easy. We don't want to scare her off. Auditors arrive April Fool's Day, which is no joke, and we kind of need her to stay. Amanda's a chartered professional accountant. And so last August when she started, the asset management coordinator position was a brand new role for us. And prior to that, anything regarding assets largely fell on my plate and with the help from a financial analyst. And so without Amanda, it would be very difficult to meet the deadlines that we are going to have to meet as a result of Ontario Regulation 588-17, which talks about asset planning and the deadlines over the next few years. So that's what led to the creation of Amanda's role. And so Amanda has been researching since last fall in order to update the policies that we developed in 2008 and 2009 when we had to bring assets on our books. So she's been busy looking at what other municipalities are doing, talking to staff in our, what we call our asset owning departments. And so municipalities began recording their assets on their books in 2009, and we had to restate 2008 for comparative purposes. So the useful lifespans we've been using for the last 10 years were based on information we had from presentations at that time. The Ontario Municipal Benchmarking Initiative, called OMBI, they had about 7 pilot sites that worked on this in advance of all the other municipalities. So they had their lessons learned and info to share. And we had recommendations at that time from staff, from the consultants back in the day that did the roads needs study and the structure inspections. And so like any good policy, once you've got some history and some experience, it always needs to be updated over time because we have assets that we no longer have due to changes. And we have new assets that, like the roll-off trucks that we're getting, that wasn't a technology that existed back then. So once we had the core data of what we owned, roughly how much it would have cost, and tried to estimate the year that we acquired it if we didn't still have assets, that recorded all of the information on our books, and we had to record amortization. So that's led us to where we are today, about asset management and 11 years of data and experience.
Thank you, Mary Lou. And Amanda, welcome to County Council.
Thank you.
Look around at all the smiling faces. We're a good group.
So good morning, everyone. I'm going to go through a brief overview of our report and the proposed policy and the attached appendices. So this will include a little bit more background on the proposed policy and how we've updated it, why we've updated it, what this means, and what we've changed. So overall, we're recommending that Grey County's tangible capital asset policies be updated so that the county's financial statements accurately represent the county's physical assets and while still remaining in compliance with all applicable accounting standards. So as Mary Lou mentioned, the county's TCA, tangible capital asset accounting policies, were originally written in 2009, and that was done to be in compliance with PSAB 3150 at the time. So at that time, the useful lives over which the county's assets were amortized were the best estimates that were available, and they were strictly used for financial purposes. And that was because asset management wasn't developed as a discipline yet. Over time, though, county staff members have gained more data on the actual useful lifespans of the assets that the county uses. And there's also been some changes to technology which has changed the useful lives of these county assets. So we consulted with relevant staff from each asset owning department, and we looked at the policies of surrounding counties when setting the recommended lifespans that we put in this policy in order to ensure that the suggested lifespans actually match the reality as closely as possible. So it's important that the useful lives in this policy approximate the real useful lives of the assets, since they will be updated in the county's citywide asset manager software, and that's used for the county's asset management activities as well as for accounting purposes. The data stored in this software was used for the county's first 2 asset management policies or plans, and will continue to be used for future plans as required for both gas tax funding and for the new Ontario Regulation 588-17. There were many capital assets that were not addressed in the previous policy and are now in use by the county, as Mary Lou had mentioned, and there's also ones that are now obsolete and no longer used by the county. There have also been changes in available products and technology that have occurred since the previous policy was written, and all of those issues have hopefully been addressed in the proposed new policy. So we're recommending that these changes be applied to all new assets acquired during 2018 and thereafter. And these changes are not retrospective since they're based on new estimates and new information, and they won't require a financial statement restatement. For assets that are already in existence in 2018, we're recommending changes be made to the lifespans of vehicles and major infrastructures such as roads, bridges, culverts, and buildings. We're not recommending making these changes to other currently existing assets such as computers and housing appliances, since those assets have short lifespans and will soon fall off the books, and they have smaller dollar values, and therefore there will not be a material benefit to going and making all those changes. And so that's really why we're here today, in hopes of receiving approval to make these changes to our 2018 year end in time for a financial statement audit, which begins April 1st. We've already discussed these proposed changes with BDO, our auditors, and the Public Sector Digest consultants, which are asset management consultants, and they also are the providers of our citywide asset management software. And they have had no issues with our proposed changes. So we've created a test database in Citywide to begin modifying the lifespans of our existing major assets to see what the effect will be. And we're doing that because this will definitely have an effect on our depreciation for 2018 and all future years. So an example of this is county, urban, and rural road bases were originally individually amortized over a lifespan of 40 years per the previous policy. With consultation with transportation services staff, we've determined that county urban rural road bases are more likely to have a useful life of 50 years, urban rural road bases are more likely to have a useful life of 50 years, and rural road bases are more likely to have a useful life of 75 years. So if you're looking at the report on page 43 of the agenda today, we have a little example chart, and that's for a road base with a dollar value of $750,000. So if we look at a rural road base, which would have previously had a useful life of 40 years, under the old policy, this would have 2018 amortization of $18,750. Under the new proposed lifespan of 75 years, it would only have amortization amount of $10,000. So that right there on one road base is a difference of $9,000. So we've already updated the road bases in our test database to see what happens, and we've already lowered 2018 depreciation by approximately $1.9 million. So it's important though to remember that this is being done to reflect the reality of the lifespans of our assets, and it's not being done just to make our ratios and financial statements look better, but it does appear to be also having a favorable effect. It's also important to note that county will continue to use owned assets until they're actually obsolete, and we will not continue to use things that are broken. So just because the accounting policy says so, we're not going to throw something away. Moving on to the actual policy, the goals of this policy are to ensure that the assets owned by the County of Gray are accounted for accurately and are accounted for in compliance with relevant legislation. So the purpose of this policy is to remain in compliance with PSAB 3150 and to prescribe the financial criteria that are used to determine whether or not to capitalize assets, to establish the useful lives of these assets, and to provide some definitions regarding the terminology that surrounds tangible capital asset accounting. And then the lifespans that are listed in this policy will also be referred to for asset management purposes. It's anticipated going forward that this policy will be refined and amended over time, as assets and their lifespans will continue to change with technology, and thresholds will likely increase over time in accordance with inflation. And staff will continue to monitor all the factors in this policy to determine if adjustments are necessary. The scope of this policy is that it applies to all Gray County departments and organizations falling within the reporting entity of the County of Gray. The application of this policy, moving into that, the capital thresholds represent the minimum dollar amount that's used to determine whether expenditures will be capitalized as assets or treated as an expense during the year in which they are incurred. And later on we'll look at Appendix 2, and that's got a whole column outlining the suggested capital thresholds. Looking at the valuation, capital assets will be recorded at the historical cost as required by PSAB 3150, as they always have been, with a few exceptions that are highlighted throughout the policy. Moving on. I've already kind of touched on the useful lifespans, but the lifespan is used to calculate the amount of annual amortization, and that's just the number of years where we allocate the cost of the asset. The only exception to this is land has an unlimited useful life and is not amortized, and the historical treasures at the museum are specifically excluded under PSAB 3150. For any assets that are not listed in our Appendix 2, the Director of Corporate Services as well as the Deputy Treasurers will determine the useful lifespan in consultation with the directors and managers of the respective department going forward. Then we have a section on definitions of tangible capital asset accounting. And if we flip forward to page 11 of the policy, we have Appendix 1, and that's a tangible capital asset recording decision tree. So this is a helpful little flowchart for staff to use when they're determining whether or not something should be capitalized, so they can go through that and apply it to their item. Then we have Appendix 2, which is the actual changes that we've made and has all of the details. So you can see that we've classified everything with a class and then a subclass and some subclass details to break things down. Then we have a threshold column, and that's referring to the minimum capitalization threshold for each specific kind of asset. Then we have the useful life for depreciation column, which is the lifespans that we're proposing going forward. We have the prior useful life column so that you can see what the lifespans used to be. And then we have an increase-decrease column, which has some yellow highlights, which highlight where we've made changes. We also have a pooled column, which tells you which assets are pooled. So pooled items are things such as the stoves and the housing units, where individually they have a greater dollar value than $500, but they wouldn't reach the $10,000 capitalization threshold on their own. But there's so many of them out there that all together and pooled together, they would have a greater dollar value than the threshold. So we do track those. So some of the changes we've made is we've suggested moving buildings from a 50-year lifespan to 75 years. And that's just because we're actually realizing 75 years of use for our buildings. We've also decided to componentize buildings going forward. So we will not go back and change any buildings that are already in existence. But this is just so we can more accurately account for the different parts of a building. So for instance, the structure will have a longer lifespan than the HVAC system, which will likely need replaced throughout the life of the building. Moving on to page 2, we have roads and bridges. So probably the largest change we've made and the largest dollar value will be the road bases, which I've already touched on. But we also made some changes to surface and for bridges based on what transportation has actually realized in the last 10 years. And we've decided to add small culverts, since before these were not ever reaching our dollar threshold, but we're anticipating going forward that they probably will, so that's proactive. We've also changed our vehicles based on what our mechanics have suggested and the useful lives that we're actually realizing on those. And we've made quite a few changes throughout the computers and technology, as obviously that stuff has changed since 2009. I think that's pretty much a summary of everything, so thank you, and we'll take any of your questions.
So thank you, Amanda, and thank you, Mary Lou. Council, are there any questions? Oh, sorry, I didn't see the hand. Councillor Milne.
Thank you, Mr. Warden, and thank you for your presentation, ladies. I think it makes a lot of sense to someone who's not numerically adept necessarily, but I would think it would be very helpful in the road rationalization discussion that I'm sure will come up in time when Georgian Bluffs regains the control and ownership of Grey Road number 1. Getting a road that it will extend in life and will not cost them near as much in depreciation every year.
Very good, yes. You don't have to answer that. So if there, Councillor Soever.
Yes, did we look at what other counties around us are doing? So we can kind of, like under the FAIR data, there's a lot of data, and you know, it's useful if you're looking at capital assets per household, you know, kind of are we using the same measuring stick?
Yes, so I did look at all our surrounding counties, and Simcoe actually just updated their policy in 2017, so that was one that I really referred to. And there are some variations, but generally we're in the same ballpark. It kind of depends on the way that we do things, so there are a little bit of differences, but yeah.
Thank you, because I have been looking at that, and our capital assets by household are not the highest in the world. So are we in a capital asset deficit that we have to catch up on, or?
I guess I'm going to quantify that with, it depends. And a
Young
prime
lawyer.
example is we've been putting away $1,361,000 for the last few years for the future development of Rockwood Terrace, an asset that was built in 1984. And long-term care has a shorter lifespan put on the buildings than we've used for other buildings because of the requirement to meet ministry requirements and the fact that they require redevelopment at a certain point, and it won't be 75 years. So there's an example of a building that's fully amortized. What I will refer to as the original administration building was built in 1960, had a 50-year life on it. So prior to the renovation, it was fully amortized. So I guess I could say it's fully amortized. We had no intention of demolishing it. And that was really the best information we had at the time using the Ontario Benchmarking Initiative, information that all the pilot sites compiled. So I guess it depends on how you look at it. If we're getting longer out of our base than how we would have been amortizing it, then we've been amortizing it faster than we would if it's a new road currently being done.
I think that's really good because, you know, it is very complex, and when you start looking at like net financial assets against, you know, your useful life of your assets. I mean, some municipalities, well, town of Blue Mountains is a good example. When you look at our net financial assets, it looks really good, and it's been touted as being really healthy. And then you look at capital spending needs in the next 10 years, and you go, well, in 10 years from now, the net financial assets are going to be zero, but we're going to have a lot of new assets on the capital side. So it's great that we're doing this so that we can get a better picture of where we really are at.
I think one of the big challenges is for the communities that have had a lot of growth, and say you had roads assumed in a subdivision, you know, the contractor built the roads, and you have to be looking at 15 years from now. Like, you look great now because you've got brand new assets.
Yep.
But 15 years from now, you need the money. Or, you know, in the case of the city of Owen Sound, you got a large grant for the water treatment plant. That created a brand new asset. So you need to look at where your source of funds were, and I guess what's your plan? We have pre-amalgamation. There were probably, you know, now with amalgamation, there might be communities that have 5 or more rec centers. You know, they had community halls. You know, then they've got a decision about, do you continue to have that many, or are you going to not replace some of them? And those are all like business decisions for the municipality.
Kevin?
I think this is a real long-range thing that, and because we're just getting our data refined and stuff, and we keep looking at, but I think we have to look at trends and stuff. I think you have to look at your asset consumptions over time and see, are you gradually going down all the time and losing, or are you maintaining where you are and you're keeping your levels of service where the public's happy? I think it's a long-range thing, but it is important to keep track of this, and by asking Amanda and Mary Lou and that to work on this, we're trying to really get what we're expensing on our financial statements to match actually how we're using our assets, and then trying to match that up, that these numbers mean more to us when we're looking at them. So.
Okay. So I'll call the question on the motion to receive, approve, and apply the policy. All those in favor? Any opposed? That's carried. Thank you very much. Congratulations, Amanda, on your first. 10 attendance. All right, we're moving to item 7C, Treasurer's Statement regarding council remuneration. Kevin's coming up, and I need a mover to put the item on the table. Moved by Councillor Mackey, seconded by Councillor Carlton. Kevin?
Thank you. This is a report that I am mandated by the province to provide by the end of March each year, which shows the expenses paid in the previous year to those that do governance for the County of Grey. So in here you'll see the attachments built right in the report that shows each councillor the remuneration paid, the benefits, which would be OMERS, CPP, EHT. Then we provide the mileage that was paid to each councillor, as well as another column which is conference registrations that are paid on behalf, expenses at conferences, the cellular, we provide cell phones, so that cost is calculated, or if there was a direct payment made to a councillor for cellular, that's tracked. Tech allowance that's provided to councillors, and any other parking, et cetera, like that, that's put in by a councillor's expense. And then the meetings attended and those statistics here were requested previously by council, have those included for information, and as well attached to this then is the remuneration that are paid to the boards we have for the Accessibility Advisory Committee, the Tourism Advisory Committee, Economic Development, or any boards that a councillor sit on, such as the Board of Health and the Niagara Escarpment Commission and AMO. So this here is, it's just it's an information report. I'm by the province. I'm mandated to do this report each year, so can try to answer any questions you have.
Very good. Thank you, sir. Any questions from council? I just want to, I don't see questions, but I want to acknowledge our last warden, Stuart Halliday, from the report I see under other meetings that he attended, 197. I also, I'm picking on a second person here, but Councillor McQueen, having attended 40 other meetings. I want to thank both of those individuals for, there's lots more to thank, but those two really stand out, and so I'm thankful for your contributions, and please pass on to Stuart, if you could please, our thanks. Oh. All those in favor? Are there any opposed? That's carried. Thank you very much. Okay, moving to the great land of Georgian Bluffs. Item 7D, Cobble Beach. Randy, I believe you're up. Can I get a motion to put the item on the floor? Councillor Desai, seconded by Councillor Keaveney.
Thank you. Good morning, everyone. So the purpose of this report is to provide an overview of proposed revisions to an existing draft-approved subdivision known as Cobble Beach. It's located at part of Lot 29 to Lot 31, Concession 3, the geographic township of Sarawak in the township of Georgian Bluffs. So on the screen there is the subject lands. As you can see, it's only a portion of the proposed Cobble Beach development that is proposing revisions to be made to it. The lands are located, of course, north of the city of Owen Sound, east of Grey Road 1, and the subject parcel itself is located north of Cobble Beach Drive. For those that have been to Cobble Beach before, here's where the clubhouse and restaurant is located. It's just in the northeast corner of that image. And here's the main entrance to Cobble Beach when you enter Cobble Beach area. So as you enter in, it'll be on your west side of where those lands are located. As you can see, and these are 2015 air photos, so there's been a lot more construction since then. You can see that there's already some lots that have been given final approval, and there's been some homes already constructed on those lots. The current draft approved plan consists primarily of residential, parkland, and open space uses to a maximum of 312 residential units, and that's excluding the mixed use and multiple residential blocks that are also have been draft approved. Here's just an image showing the proposed changes, which are in red. The applicant is requesting revisions to what's known as blocks 50 to 56 in the current draft approved plan. The one key change, and I'll try and highlight it on the screen here. So right now, you can kind of see it underneath the plan, but there's a cul-de-sac on Street G that's currently the draft approved plan. The road network then bends down this way. What they're proposing is to eliminate that cul-de-sac and make the roads go straight through, which is actually overall it's an improvement to the design of the plan for sure. They're also right now they're just identified as blocks with a maximum number of residential lots that can be permitted with those blocks. What they're actually proposing is to identify what those lots would actually entail within those blocks. So there's proposing 65 residential lots in total. The draft approved plan provides a range of 54 to 77 units, so 65 units would be within that range that's been draft approved to date. The total count of residential units for the overall development would change slightly as well. Again, this would be within the draft approved range that's in the current draft approved plan. The applicant has submitted a planning justification report, a functional servicing and stormwater management report, and revised draft plan. Copies of all those reports and plans can be found on the county website. We've also circulated these to members of the public and agencies for comment and feedback. The township will be holding a public meeting on April 10th for the proposed revisions, where we'll be hearing comments from members of the public. So at this stage, what we're recommending is that this report be received for information. Following the public process, we'll be bringing back comments that were received from agencies and the public and making a recommendation to committee at that time. Happy to take any questions.
Randy, questions from council? I don't see any, but I do have one. There is a walkway sort of between lots 80 and 81, which seems to lead to where there was an existing roadway to the north.
Yeah, this one right here?
Yes. So the question is, what's going to happen with that roadway?
Yeah, so it's actually, I think, that part is an easement, municipal reserve for.
There seems to be a walkway.
Yeah, I think it's for a servicing connection easement for that walkway. So what will happen is the walkway will connect to some of the trails that have been developed in conjunction with the golf course that surrounds the entire property. So the walkway connection would tie into that trail network essentially.
Got it, but the roadway that leads to County Road 1, what's going to happen with that roadway?
Yeah, there's, I think the long-term plan is that wouldn't exist. Yeah, and I don't think it exists today. It might be just an easement for a servicing easement.
I see, it's not an actual existing roadway.
Yeah, there's been some changes and alterations to Cobble Beach over the years. Initially, at one time, there was a proposed entrance that I think was coming off of there. That's now, the main entrance will still be the Cobble Beach Drive entrance, which exists today.
Okay, Councillor Mackey?
Thanks, Mr. Warden. Randy, do you know what the capacity of the sewage treatment system out there is? Like, how much development can they absorb with the current system?
I don't know offhand. What I know is that the system's been designed so that they can add cells as they go. But the overall capacity is actually, can be designed and built to service beyond the Cobble Beach development. And I know that Georgian Bluffs has been having discussions with Cobble Beach in terms of, because the plan is eventually that Georgian Bluffs will take ownership of that sewage treatment plant. That will provide an opportunity for Georgian Bluffs to service other lands beyond Cobble Beach. And so that's something that I know that Georgian Bluffs has been actively engaged with the Cobble Beach developer on in terms of when when Georgian Bluffs would take ownership of that, so that it can service other developments in this area to make them fully serviced.
I don't see any other hands, so I'll call the question then. All those in favor? Any opposed? That's carried. Thank you very much, Randy. Is there any other business? Councillor McQueen?
Yeah, just briefly to you, Mr. Warden, County Council, you and I were speaking just the other day about that committee of County Council or a representative to sit on called Alice, and I just wondered where that is at, because traditionally the warden would sit on it, but I think last year Councillor Barfoot stayed on there from the warden at the time, so I was just looking it up here on the computer and just thought I'd follow up on that.
Clerk is saying that she will look into that.
Sorry.
Yeah,
Yeah.
get back to you. Any other business? Seeing none, I will entertain a motion to, oh, yeah, sorry, notices of motion. I haven't heard it. Councilor McQueen?
Again, thank you, Mr. Warden and County Council. Knowing 2009 as the third year or fourth year of assessment period, also knowing that average farm assessment has increased during the 4-year period in Grey County to over 70%. Moving forward at the next county council meeting, I would like to see consideration be given to reduce the farm tax rate from 0.25 to 0.24. Furthermore, an invitation to the Grey County Federation of Ag to do a presentation to the Grey County Council to explain further. And I can give a photo of that.
Thank you for that. Is there any other notices of motion? Seeing none, I will now look for Councillor Milne moved to adjourn, seconded by Councillor Boddy.
Mr. Warden, I know it's out of order, but I will note that today is Annual Pie Day. It's Annual Pie Day, 3.14. And I noted that there are 4 of them on the counter in there, so enjoy, everybody.
Excellent.
And we do have
Okay,
training following.
so we are now adjourned.